Kenya, we can move speedily to be a smoke-free country, to reduce the burden that comes with the mortality and morbidity from the use of tobacco in the country.
We are public health advocates, researchers and consultant clinicians, and this is our statement. So public health advocates statement on the Swedish model. Groundbreaking success in the fight to reduce the toll of cigarettes in Sweden could provide major benefits for the rest of the world and save the lives of millions of smokers here in Africa. Sweden has begun celebrating its imminent status as the first developed nation in the world to become officially smoke-free.
The e-cigarette is nicotine, synthetic nicotine that is being banned. That you are burning, you are heating the synthetic nicotine and you are releasing the smoke. I've said it is not risk-free. It is 95% less risky than burning the real cigarette. When you burn the real cigarette, the smoke that you get is not the same smoke as from the nicotine. The smoke from burning a real cigarette has tar. It has other millions and millions of toxicants that cause cancer. That is why WHO was able to quote very clearly that nicotine does not cause cancer, but burning a cigarette causes cancer. So we cannot, when you look at the smoke from a nicotine electronic device delivery system and from one burning a cigarette, those are two entities different of smoke in terms of risk.
To beat smoking like Sweden, we urge our politicians to support harm reduction strategies and make smoke-free alternatives more affordable than cigarettes, thereby removing barriers to switching. Similarly, health professionals and smokers should be educated in the science involved so that they can make informed choices. Kenya can and should benefit from Sweden's successful switch to smoke-free status. Our policy makers must simply apply the same evidence-based solutions that have already started to save millions of lives. We'll end the session there. Thank you very much.